everyone, myself Dr. Priyanka and I'm one of the mentors for Study MRCPI. So we are doing OSCE Made Ready series, that is OMR series, where we will be discussing important exam-oriented sessions which are very important. So today we'll be discussing on homework plan, simulated patient task. Okay. So do like, share, and subscribe Study Medic channel and also press the bell button icon to get the recent updates on the recently added videos. So do remember that the future depends on you, what you do today. Yeah, so this is a simulated patient task where the patient comes at 41 weeks for the birth plan. So I will be playing as or as an ST5, okay, in the antenatal clinic and also as the role player, okay, Priya King. Okay, so hello, I'm Dr. Priyanka, one of the doctors in the antenatal clinic today. May I confirm your name and age, please? Hello, I'm Shreya King and I'm 38 years old. How would you like to be addressed? Priya would be fine, doctor. So, Priya, I can gather from your notes that you are in your first pregnancy and you are currently 41 weeks and you have come here. You have been referred by the midwife to for the further plan regarding your pregnancy, right? Yes, doctor. So first of all, Priya, I would like to apologize because my consultant is not available today and he is attending some emergency. So is it okay if I talk with you today and I can book an appointment with your appointment with him later? Sure, doctor. Thank you, Freya. So, Freya, can you tell me more about your concerns? Yes, doctor. So, doctor, I'm in my first pregnancy and everything has been going so far well. But then it's like I was given a due date a week ago, but still I do not have any pains, and that's why my midwife has referred me to you actually to decide regarding the birth plan. Okay, Freya. Can I ask you a few questions regarding you because I'm meeting you for the first time? Sure, doctor. But doctor, I just want to tell you that I don't want to deliver in the hospital. I want to deliver at home. By any means, I don't want to deliver in the hospital. So, Priya, I can see that you're very concerned, but can you tell me why? Is there a specific reason that you do not want to deliver in the hospital? Yes, doctor, because I had a friend. So in last year, she was pregnant for the first time, and then she was admitted to the hospital because even she didn't had pains in time, and that's why they had given some pain medications to kickstart her labor. And then actually it was so fussy in the hospital, and there were no beds actually properly in the labor room. They were going to break her water bags, and then the beds were full, and then later she got the bed was empty, and then they later did the break the water bags, and then afterwards something happened, and they were telling her that the baby's heartbeat is not going on well, and then suddenly they did the cesarean for her, and then she was bleeding very heavily at the time of cesarean, and almost she lost 4 liters of blood, and and she couldn't bond with the baby also. So I just am really scared. I don't want such a situation happening with me. Oh, Freya, I can see that you are really disturbed because of your friend's condition. So how is she doing right now? How is the baby? Yes, the my friend is doing well right now, and she then received the blood transfusions after the delivery. She is now doing well, and the baby is also doing on well. Good to hear that, Priya. So, Freya, I would just like to tell you that yes, it was very unfortunate that it happened with your friend. But to remember that like every case is a different, and don't worry, we as a team of doctors are there here to help and support you. Okay, doctor. Priya, can I just before going to the further plan regarding your pregnancy, can I ask you a few questions regarding your? Okay, doctor. So, I can see, Priya, that you are pregnant for the first time, right? Yes, doctor. So, how is the pregnancy been so far in this pregnancy? My pregnancy is going on very well, doctor, and that's why I want to have a home birth. Like I had all the scans done, all the blood tests done, the Down syndrome. They did some blood tests for that, and everything came out to be normal. So I just want to have a home birth. Yes, your concerns are justified there. And yes, home birth is actually a good home birth has its own benefits because it feels like as you deliver in the home, so it feels the familiar condition. Your relatives are there with you, and then the recovery, if it is successful, the recovery is quite early than a hospital birth, and also you can early bond with the baby as soon as possible, as soon as the baby delivers. So yes, so there are some benefits of having a home birth, but yes, everything has a benefit and also some risks. So uh, so Freya, can you tell me where your periods regular? Yes, doctor. And where your the previous scan, the third month scan was told to be correct with matching with your periods? Yes, doctor. So I can see that you are 41 weeks pregnant today, right? Yes, doctor. And any allergies you have? No, doctor. And your weight to height ratio, Freya? My weight is normal, doctor. So Freya, how far do you stay from the hospital? I stay 10 minutes only, doctor. So if anything emergency, I can come in. I can come if there is some problem to happening during the labor. Okay, Freya. And Priya, can I ask you regarding personal questions like what are your future plans regarding pregnancy? Yes, my sister has almost 3 to 4 kids, so even I am thinking of having at least 4 to 5 kids. Okay, Freya. That is good. That is good. So, also, can you tell me how is support at home? Yeah, my the support is very good. My husband is very supportive. Okay. And any problems you are having today? Have you named your baby? Yes, I have named her Sarah. So, how is Sarah kicking today? Yes, she is kicking well. Okay, thank you, Freya, for telling me about yourself. So, coming to your concerns. So, yes, as I said, home birth has its own benefits, but I can see that you are 41 weeks pregnant and you have already 1 week past your delivery date. So, what happens, Freya, is there are some options for you available, like we can give you pains and kickstart the labor, or you can continue to be at home and then come after 1 week, like after 42 weeks, and have the medications to kickstart the pain. Because I would like to tell you, Freya, that yes, home birth has some risks, because if you can see that you are almost 41 weeks, so the studies have shown that the women who are 41 weeks or almost 42 weeks, that there is increased chance that there are some problems to you and also the baby. Would you like to know, Priya? Yes, doctor. So if the pregnancy is continued, then there is increased chance the baby may pass tools inside the womb. And the same thing that the same if the baby may swallow this, and that's why there will be problem. There can be problem with the breathing difficulty with the baby. Oh, is it, doctor? Yes, I don't want to scare you, Freya, but I will be honest with you. And this happens when the pregnancy is kept to be continued. And another things like the baby may grow again more big. So the more we wait, the baby size gets more. And that's why, because the baby gets more in size, so we call it as macrosomia. So there can be difficulties in delivery of the baby, and difficulties in monitoring, and hence if it is done at home, so the labor may take long in this case. And also whenever the baby delivers, the baby's shoulder may get stuck, and after the head delivers, and there can be injuries that can happen to the baby. Am I clear so far, Priya? Yes, doctor. And also because of the increased baby size, there can be you can have tears down below, and that will be difficult. That are sometimes difficult to suture, and also there is increased risk of bleeding after the delivery. Also, Freya, am I clear so far, Freya? Yes, doctor. And the studies have shown that these babies who are where the delivery is not done by 42 weeks, so there the oxygen content in the blood is low, and hence after delivery, so the chance of admitting them in the baby special baby unit is high. Uh, Priya, am I clear? Yes, doctor. So this for these reasons, that's why after 41 weeks, and like after 42 weeks is the maximum where we wait. After which we give medications to kickstart the labor in the hospital, and also you and the baby will be monitored by the baby's heartbeat monitor. But no, doctor, I don't want any wires to be connected to me. No problem, Priya. So there are some patch like monitors come which are portable and which you can walk keeping them, and they can monitor the baby's heart rate. Okay, doctor. So that would be nice. So these are the monitors which will be available where we'll be monitoring the baby's heartbeat, which is usually not possible at home, Priya. That because in at home we can just in between monitor the baby's heartbeat, but we do not know that it is going normal or not in the serial, and that's why the chance of having any problems at home will be high, Priya. Okay, doctor. Or if I want to wait, doctor, what can I do? So yes, where you are 41 weeks now. So if you want to wait, you can have one more week, but provided that there will be at least twice, in the coming week, at least twice you will be monitored for the baby's heartbeat in the hospital, and also there will be a scan done to look for the fluid around the baby, because the fluid around the baby gets decreased after the time has elapsed. Okay, doctor. And also, we will tell you to monitor the baby's movements. Okay, Priya? Yes, doctor. So, Priya, I know I have given you a lot of information, but I will just provide you with the patient information leaflet regarding the which we call it as a postpartum or a prolonged pregnancy, where it has already passed the due date, so that you can go through, and also you can go through the delivery plan. Is that okay, Priya? Yes, doctor. And then you can let us know, and in the meanwhile, I will book an appointment with your with my consultant next, coming soon. Okay, Freya? Yes, doctor. So, what are your thoughts now, Freya? Yes, I definitely want to consider having a hospital delivery doctor after hearing the risks. Okay, Freya. So, I will just give you the hospital contact numbers. So, do monitor the baby movements well, and also I will write back to your midwife. Is that okay, Freya? Yes, doctor. Thank you for your time, Freya. Thank you, doctor. Yes. So here, this is a negotiation task where the patient will be adamant or insisting on having the home birth, where there are some risks involved in this patient. Like the patient is already a postpartum pregnancy, where she has already crossed 40 weeks of her pregnancy, and here they will be insisting on having a home birth. There can be reasons like their relatives who had a or friends who had a bad experience, or their personal history. If they had a previous pregnancy, so they must be having any mishap happen during that pregnancy, and they do not want to have a hospital birth. So here you have to sensitively explore the concerns, the reasons why they do not want to have a hospital delivery and they want to have a home birth. And you have to initially, even if the home birth is not suitable for them, but still you have to start with the benefits of having the home birth, so that you are not crossing their you are not they shouldn't think that you are not giving any importance to their views. So yes, you can give the risks and benefits of having both the home birth and the hospital birth, and you can tell them after taking the history and also their clinical or doing the examination, and also the clinical depending upon the clinical scenario, that why this is hospital birth beneficial for them. And if still they are adamant, finally, even at the end of the station, if they are still adamant that of having a home birth, then you can definitely tell them that they can meet the consultant, and he's the one to decide where about the place of delivery, because it is not an STPI's we are not supposed to decide, but the consultant will decide about the place of delivery. So here, yes, she is 41 weeks. So if she wants to have an expected management, she will be monitored for twice weekly, CTG and also amniotic fluid index. Then here we should be non-judgmental. That is her views. So we should not be questioning that it is you are thinking wrong or this and that. So we have to explore the concerns. There are some reasons. That's why they are wanting to have a home birth. Very sensitively, we have to ask, and then we have to explain them in the lay language and telling them why it is not suitable for them. Okay, and the final decision even if they are adamant, but finally do not agree on home birth, if especially if they are postpartum or especially if they are with previous cesarean section. Okay, so here you have to obtain a relevant obstetric history about their future fertility wishes, about how far they stay from the hospital is very important. Okay, and how is the support they are having is very important, and previous obstetric history, if they had any previous deliveries, the mode of delivery and any complications they had during the delivery is very important. And you can tell about the different options that are available, that is expectant management till 42 weeks, and doing the surveillance by CTG and an ultrasound for amniotic fluid index, or having a induction of labor right now in the hospital. These are the options you can give them, but definitely homework you cannot give them the option. Okay, so you can tell them that there is increased risk of perinatal mortality in the lay language, and as I said, that there is increased risk of having prolonged labor, and there is increased risk of macrosomia, and due to that, there is increased risk of having the risk of operative vaginal delivery and cesarean, and that's why and it is an acute event, so that's why doing having a home birth in these cases is not usually advised. And you can give them option of having a membrane strip right now, or an induction of labor right now, or they can wait for 1 week and then later we can have induction of labor after 1 week of twice weekly monitoring. So that was all about this station. Thank you so much.